Do you want to be able to hear, or?
I know what the guys want.
I know. If you end up in fights about how you're not talking clearly, your dad has a hearing problem. This is Lisa.
And this is Lana.
We are two old friends.
A nurse.
And an actor who are both taking care of our parents.
I got some troubles and I don't know what to do. I got some worries and I'll share them all with you. Sometimes we'll talk it out, or maybe scream and shout. It's always easy when I see you through with you, 'cause we are two old friends talking to old friends. Not too old.
This is a podcast about what to expect when you're not expecting it.
I am a fast talker.
And we're trying not to be super negative Nellies here, but we will be shortly.
Two old friends talking to old friends.
On this episode today, we are going to be talking all about hearing loss. Can you hear me now? And how our elderly parents struggle, and we struggle dealing with them struggling.
Yeah, and when you think about how many people does this impact,
Yeah.
statistically, half of the people over 65 have hearing loss. It's significant.
And statistically, only 2 people are actually willing to wear the hearing aid. Trying to get your parents to wear a hearing aid is half the battle.
Yes,
Yeah. So,
Oh, gosh.
let's go over briefly, basically the stuff you can Google. Because there's a lot of stuff on the internet that's going to give you, how to handle it and what you can do and the signs of it. And then we're going to talk about the things that we have learned ourselves while dealing with our parents that I think, to me, is more beneficial.
Yeah, exactly.
And we're going to be looking at it from, as always, a nurse's perspective and an actor's perspective. And it'll give us a chance to sort of see the clinical side of things and how you deal with that, and then the emotional side of things, although we both deal with both.
Exactly. Exactly.
Okay, so what is it? What is hearing loss, and what causes it?
Well, and just simply, as you get older, it's a pretty sophisticated system. And it breaks down with age. And we can go
Absolutely.
into all the things, but just realize, this is part of the natural aging process. It's going to happen.
And it's normal. And we're not going to be talking about hearing loss, like people who are born with it and stuff. We're really focusing on, people who are aging. Okay.
You got it. Yep.
So one of the causes, there can be chronic exposure to loud noises. And that is, hey, if your parents were rockers back in the 60s and they put their their ears right against an amp, or they played guitar, it could happen.
Yeah.
They're going to have some problems. Or if they were in the military, things like that.
Exactly.
The other one is earwax. Isn't that silly? It is such a big deal. And I think as you get older, your body starts producing all sorts of weird, drainage, mucusy things. And maybe that's why you just get a lot more earwax as you get older.
I've noticed it, but we won't digress. That's I'm oversharing there. But earwax is something that can something as simple as that. And I remember, Lisa, years ago, you were talking about, you were thinking, boy, my dad is losing hearing. And it come to find out, he did have the hearing aids, but they weren't working because no one looked at the earwax thing. So
That's
it's a
huge.
simple thing. And I think part of that, when you're looking at causes, there could be a medical cause. They could have an infection. They could have fluid, da-da-da-da-da. The point is, get a medical evaluation.
The other thing,
is there something going on?
Exactly. Is there something
going on?
Is
a simple fix.
The other thing that really surprised us when we did Google this was the amount of medications that can cause hearing loss. I was like, I did not know that. So there's things like that can actually damage it. First off, it's antibiotics, also chemotherapy. But the one that's going to probably cause a lot of distress is
Viagra.
Isn't that crazy?
I know. I don't even know that. How does that happen?
It's I think you have to balance it out. Which do you want? Do you want to be able to hear, or?
I know what the guys want.
I know. And I know what the women want. Just hear me speak.
There's a different motivation there.
So, and the other thing is even high doses of aspirin, diuretics, and anti-malaria. And I don't know, that made it sound more like ringing and some hear loss.
Yeah.
I don't know if that's as much as hearing damage, or if it's maybe if you stop doing the aspirin, then it kind of comes
the
back
side
a little
effect.
better.
Yeah.
So either way, those are things to consider too. So before we go spending a small fortune on a hearing aid, that is something to consider.
I just thought of this. Okay, so we're in COVID times here. Is the masks?
Oh, for sure.
Because it's muffled.
It
It
muffles.
blocks. You can't read the lips. But yeah, I just thought of that. Yeah.
Heck, I have a hard time, and I've got pretty good hearing. I didn't realize how much I read lips until they had a mask on. This is important to know because you may be seeing your parent deal with issues that the hearing loss causes, and that is depression, isolation, cognitive impairment.
I want to pause on the cognitive impairment. One of my friends is a speech therapist, and she was explaining to me when you stop to hear, there's a nerve pathway and there's a part of your brain that needs to be active. So think about like if you don't use it, you lose it.
Right.
And so as you start to lose hearing gradually, you start to lose that cognitive functioning.
Is it that you're losing your hearing, or is it that you're losing your ability to communicate? Because if somebody is signing, they are still communicating, and they are interacting, and they're thinking through something and communicating it and listening to somebody and processing it. But if a person is losing their hearing, but they're not learning sign, they're just old and losing their hearing, they're actually losing connection and communication skills, which that would cause cognitive impairment. You would not be able to process things in the same way because you have no ability to understand on a literal sense and then on a figurative sense.
Absolutely.
That's really interesting. So the other issues with that, problems with hearing is that, and this is a huge one, I think, for my dad, is like he can't hear the doctor, he can't hear, alarms, or, it could be doorbells and phone rings. That's not as big, but you can't hear when someone's explaining something really vital to you. So how does that impact? And if we're not there with them, not only are they not understanding what the doctor says, or is it more, they're freaking just not even hearing it. And I know we'll talk about this more, but it's huge. That is a very big problem, is the not being able to access what the pharmacist tells you to do. Take one pill, and they can read it, but half the time their eyesight's going. So, or they're saying, and if you feel this, let us know. Did they hear you say that? So now where are we
no
at?
wonder they're not doing what they're supposed to be doing. Because they did not hear it.
They didn't even hear it.
Yeah.
And then you have difficulty on the phone. My dad truthfully can't hear basically any young female woman because the high notes.
The high tones.
And it's frustrating for him. So those high tones. And then my mom said something to me that once you've retired and you're not traveling, or you're just kind of in home and you're in that quiet world, when you talk to somebody who's outside of your home,
the pace of retirement.
Yes. And she said, everyone in the outside world talks a mile a minute. And I know me, I'm like, if I talk to somebody, if I'm excited or something, I fly. And she goes, you get on the phone with somebody and they're talking so fast, you're not hearing nor comprehending, and you can't even, you start to feel a sense of panic as they're talking. So
there's a pace. Yeah.
There is a
I'll
pace.
have that if I'm really busy at work. And then I call my mom and it's like, all right, and part of it, it's like, I have got to get this through to you in 30 seconds because my meeting starts. So blah, 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 blah. And not only am I a high-paced work, but I've got a lot of information to tell you, so probably not the best time, but I just want to get it done, okay? So, and I am you hear this, I am a fast talker. So I need to, and that's a habit that I need to be aware of, but that's all part of processing, and I think that's an excellent point, Lisa. We are not in retirement.
Nope.
And the pace is different. And I'll even have that when I'm off for a week at work.
Yes.
And then I come back, I'm like, what are all these people so excited? And the amount of information, the speed of information, all of those things, it's a different pace.
Absolutely. What's the big problem when we're dealing with hearing loss of our parents?
I think it's gradual.
Yeah.
It
happens
just does
so
not
slowly.
happen where all of a sudden you can't hear. This is just every day. It's a little bit less. That's tough.
It's tough to see it because, or to hear it, I guess I should say.
Yeah.
Because you just kind of like, oh, what's wrong with them? And they're like, ugh, what's wrong with them? And, you know, there's almost like you don't realize there's an issue because it's happening so slowly and incrementally. And then they get tested and it's like, oh my God, they can't hear anything. No wonder. So, okay. So the question then is, how do we spot it? There's going to be a change in the way they start speaking. So one of them would be muffling. They're I think you said that your dad got that. Yeah. My dad got louder.
Okay.
You know, and even now when he puts his hearing aid on, he'll immediately start talking softer because he can hear himself.
Oh,
you know, and it's like, you're like, oh, there it is, you know? And they don't know.
Well, it's like when you have headphones on.
Yeah.
Hey, you know.
Exactly.
So it's that concept.
Or you're at a concert where you're screaming into your friend's ear.
So any kind of speech changes really could be a sign.
Absolutely. Know? So you got social settings.
I notice with my mom, social settings, you know, she has hearing loss. She wears hearing aids. She's like super compliant with everything. I'll say, hey, let's go out for dinner. And she'll say, well, I don't want to go to that restaurant. It's too loud.
Yep.
Or, you know, that's so the background noise.
Mm-hmm.
Yeah.
Big time.
So I've noticed that it's too loud.
Exactly. I'm that way myself.
Exactly.
I'm not really good with background noise. I can't filter it out.
The TV, anything, or even someone else talking can really be, it can be distracting, but then it just impairs the hearing as well.
Absolutely.
Yeah.
The other thing is like consonants. My dad said one time it feels like he's only hearing the vowels because if you think P and T, all those, especially the beginning and ends of words, are very subtle. Like you can hear the ear, you know, but you don't necessarily hear the.
Well, or consonants sound the same. You know, V as in Victor, B as in boy, D as in dog. I mean,
put yourself on a phone.
That. Yeah,
on a phone, I can't hear it.
There you go.
So they have a big. My dad said it sounds like people are going and he's like, I don't know what anyone's saying. So consonants is a big one. If they want you to, if they say things like enunciate. That's a sign that they are having a hearing impairment, having a hearing loss.
Or they start to say, "You're mumbling."
Yeah.
Why are you mumbling?
And you're like, I'm not mumbling. Yeah, those are big ones. And they can get belligerent about it. My dad will get he'll get really pissy about it. And I think that also that is a little bit of.
Maybe an early?
It's early signs. Yeah. And it also, I don't want to just say gender roles here, but I do think that men, and maybe it's that generation, get angry at you for not doing it right, while women will take it onto themselves.
Yeah.
And they'll start, they won't even talk about it usually. They'll just like suck it up because there's something wrong with me. Right. And while men will be like, what's wrong with you? And why aren't you talking more clearly? So if you end up in fights about how you're not talking clearly, your dad has a hearing problem.
Yeah.
Obviously we know the turning up the TV.
Yeah.
Like you walk in the room, you're like, holy cow.
It's funny. Yeah. And I'll even have that, I go into my car in the morning and I'm like, okay, what was
happening to me?
I don't know. I must have really liked that song because it just about scared me out of the car. But yeah, the volume, that's pretty standard. Yep.
And then there's the withdrawing from a conversation where they don't want to be a part of it, and you think, oh, they just want to be alone. No, they just can't hear everybody, and they get frustrated, and so they just withdraw. Then there's like my dad, and I think a lot of men, my grandpa was like this too, they talk nonstop. My dad will tell stories. My grandpa, every time you sat down, he'd tell another story that you'd heard before a billion times. And the truth is, they want to feel connected to the family. Yeah. And if everyone's talking and laughing and they're not a part of it, then they feel left out, obviously.
Right.
So the best way to be a part of it is to talk, because they can at least hear themselves. And all you have to do is smile and nod. And they're like, see, we're all connected now.
Yeah.
And
they know what they're saying. They're part of it. Yeah.
They are involved. They are. And I do believe connection is way more important in this scenario than we realize. And that instead of just going, oh my God, my dad won't stop telling stories. Right. He might not be feeling like he's a part of the group, and that's his only way he can. So that is a big one. And we wrote this down, even though they did. We got a lot of these from the web, but the one that I thought was funny is the turn. This is mine. Turn signals. You know, when you have somebody has their little blinker on, blinker, blinker,
Yeah,
blinker, they're super quiet.
And it's a high tone.
Yep.
Yeah.
That is an early sign that somebody is losing their hearing because you'll see somebody driving down the road with the blinker on for 4 miles.
Right.
And you pass them and it's usually somebody older.
Right.
And it's because they just didn't hear it. Now, it might be somebody has their radio on, but usually it's an old person who, until they see the blinker is on, they certainly didn't hear it.
They don't hear it.
Yep. Yeah. So those are ways of spotting it. That's an early detection is not hearing the blinker. What can we do to help our parents? And these, again, you will find on the Google.
Well, and we talked a little bit. I mean, just really make sure that there's no earwax, but then realize that this can come back.
Yeah.
And so if you feel like, oh, we got it, it can build up again pretty quickly. Or, just making sure that that's part of their physical exam. Yep. The earwax.
Absolutely.
That's a simple solution.
You can also do closed caption on the TV.
Yeah,
My dad is a huge proponent of closed caption. It's getting harder as he gets older because it goes really fast. So it's a little bit tricky. But closed caption. Also, they do have hearing aids that connect into the TV. It's a little box that is connected.
So kind of amplify? Yeah.
Yes. Yeah. That is really helpful.
Yeah, that's a really good. Or, my parents lived in a condo and they had to be careful.
Yeah.
I mean, they cannot have the TV blaring with the neighbor right there.
Right. Unless they're deaf also, and then they don't notice.
Yes. So, that can be really helpful.
I think also texting and FaceTiming are nice. The texting, obviously, it's letters, Lisa. And then hold on, and the FaceTiming is really great for being able to read lips, and this way they can feel connected.
Yes.
Now you can go ahead.
But that involves technology.
And that's a future episode. Yeah. Technology, a lot of times their fingers don't even, my dad has numbness on his fingers, so he can't feel the buttons half the time. It's even affecting the TV remote at this point because he can't feel it.
Yeah.
So,
and there's something with the temperature.
Yep. My dad's fingers the screen won't access his. I'm like, are you alive? Like, what is wrong? Because the screen does not see you as a human existence. They're like, we don't recognize that cold thing that just hit against the screen.
I know. And it's, my mom has quite bad arthritis and it just is painful. I mean, she can't, when you think about the numbers or the letters, they're close together. Yeah. Like they don't have the dexterity.
Yeah. They don't
punch that, like hold the phone. They have an arthritic, they can't feel. It's a cold thing. I mean, so that is a great option.
Actually, we do have a section on why those solutions don't work.
We're already going there.
We're already going there. And we're trying not to be super negative Nellies here, but we will be shortly. Is that the other one is, and this is important to know because obviously hearing aids.
Yes,
that's huge.
Stating the obvious.
However, you told me, Nurse Lana, about how to pay for those. And I think that's important for people to know that if you were in the military, then
so definitely check if you have VA coverage.
Okay.
In hearing aids, I mean, I've been a nurse for years, and then I started to specifically work with elderly population. I didn't know most plans don't cover them, and they aren't cheap.
They are not cheap.
I mean, we're talking thousands of dollars, and who has that sitting around? Nobody, because number one, they don't want them anyway. But definitely, some plans do cover them. So definitely look into that. Always remember the VA benefit.
Yep, okay.
In the military.
Because you were saying a lot of times they do in the VA because a lot of the times those people were in war situations or something where there was loud.
Chronically exposed. Just being around loud noises can really, or a drone. Like let's say they were on a Navy ship. And the motor
of
that ship.
Yeah.
So what happens is that just to simply put it, that part of your hearing system is like, you used me way too much and I'm not going to work anymore because that is the drone of the ship. So even if it's just, of course, loud noises, but even a fan or, let's say they ran a press or something and it was
Yep. So it doesn't just have to be them being rock musicians.
No. Yeah.
And the other one was
is
said.
Your dad Def Leppard?
Oh, deaf?
Yes. Just saying.
Did you even mean that?
Did you think of that?
Yes, I did. I just thought it was like... Good one. Okay. You also mentioned to me when we were talking about this earlier this morning, Medicare.
So Medicare is for the oldies.
Okay.
Medicaid is for people that are disabled or very poor. So that's we'll go into that in another episode.
Okay, but so this one, who covers it in general?
Medicare is what you're going to want to. So
you're going to look at your own insurance or Medicare or VA. So that's your basically your options.
Yeah,
I love it. So okay, so now going on with my notes, why these solutions aren't effective or cause problems. Hearing aids part 1.
Or maybe scream and shout. It's always easy when I see you through with you, because we are
hearing aids. Let's just talk about the basically annoyance of hearing aids, shall we?
Yes. So number 1, they're small because no one wants to see them in your ear.
Right.
So that's fabulous.
However,
elderly people do not have the dexterity to manage this little tiny thing with little tiny batteries, with little tiny...
It's ridiculous. And my dad at this point is mostly in his bed. We're trying to get him back into the wheelchair, but mostly in his bed, which means he drops things. Which means it's one more thing you have to go and try to find underneath his bed or in his covers or in the pillow, because he doesn't know where it is. And even if he wasn't in bed and he was in his chair, he'd still drop it. And how many old folks do you know that can climb down onto the floor, head under the couch to find their hearing aid? No one.
And those batteries are little. I mean, they're like impossible. The size of a pea. There's metal. They're slippery.
No fine motor skills for that kind of stuff. Even I had a hard time when I had to do it for my dad. I was like, that's ridiculous. I mean, that's all I could think. Not only that, hearing aids, as you mentioned before, hugely expensive. If your insurance covers them and you lose them, you have to wait a couple of years, 5 or something ridiculous. Oh, the other thing, we just said that so many old people, especially old men, seem to have a hard time with high notes. And how do these dang things work is like the way you know it's accessed when you take your finger and try to touch that itty-bitty button that's sitting above your ear, and you hit the button and it goes like that to let you know that it's on. I'm like, did they hear the
No, they did not.
I mean, like, it's like, that's why we have the hearing aid. And if it's not on, they're like, I can't tell. Did it do it? Because they can't. Oh my God, that just drives me nuts. I'm like, why doesn't it go bong or something like that it's
the gong show?
Like
we need a gong, not a little cool like techie thing.
Exactly.
And that's just I'm on the IT. They are extremely complicated. Yeah. So it's like, oh, this is great. It connects to your phone.
Connects to your TV. It connects to no.
They cannot figure this out. Okay, press 1 for this. Press 1 for that. 2 times for this. 2 times.
Even I was confused.
Yeah. Great, but they're very complicated.
Aside from that, they break them. Something doesn't work. Is it the battery? Is it did the wiring get? Or my God, my dad has like a ton of earwax. Is there earwax inside the little thing? That's half the time.
About that.
Oh yeah, you got to clean those puppies out because the earwax will be not in their ear, but in the dang.
I have that with my iPad buds. It's kind of fun. Like, yeah.
You have it what?
It's like the earwax in.
You're gross.
I know. I'm just oversharing again. Well, and you know what my mom did is she wore them in the shower. I mean, so that didn't work.
Well, once you're used to them, you don't know they're there. I mean, half the time I try to find my glasses and they're on my head.
Right. Or my phone. I've done that.
Oh, yeah.
I'm like, where is my phone? And I'm talking on the phone.
My sister. Exactly. So they figured they're there. That sucks. I love this phrase that you told me your mom said about the fact, because the hearing aids go over the ear, right? They go in the ear, and then the equipment itself goes over the ear. So what does your mom say?
She's like, I just don't have enough real estate in my ears. So I've got my glasses, I'm wearing my mask, and then I have my hearing aid. And then if I have an earring, I mean, she loves to talk about that. Like, she does not have enough space around her ear. And I never thought about it.
Yeah, the glasses along. And then my dad doesn't have earrings, but he does have the glasses. And then here we are yet again, pandemic, masks.
I know. So one of my good friends is a dental hygienist, and she said, no joke, I have talked to patients, 5, that take off their mask and that flips out their hearing aid because it's, it's elastic. Swing, there it goes. Well, they don't hear it fall. It's gone.
Yeah, and $3,000 down the drain.
Yeah, $3,000 down the drain. So they're easy to lose. And then just trying to keep track of them. Like, let's say they take, I know with me, I can hardly find my keys half the time. Right. So now we're trying to find this little hearing aid.
It's crazy. And is that the reason why they don't ever want to wear them? I don't know, but I know.
But there's barriers to that. Yeah.
Yeah. Your mom, you said, is really good about wearing hearing aids.
Yeah, she is.
My dad, it's become like, I don't know, but sometimes I feel like he's angry with that we even ask. And even though he knows his hearing is the situation it is, he will still all of a sudden regress to back in, 1982 when we were all saying that maybe he has a hearing problem. And he's like, it's because you're not speaking clearly. And we're like, really, Dad? We're back to that? It's been 40 years. It's you. It's not us.
Exactly. So, but there's just this social embarrassment.
Yeah.
They're embarrassed of having to wear an aid.
An aid. Okay, so I have a story about that. When I took my dad was a teacher and over at a middle school, and they get together with all the older teachers. We'll get together once every 6 months or something like that, and they all head back to the school and they get donuts and coffee. So I brought my dad. This is back when he was able to get around in the wheelchair, and at one point, he was sitting across from the table from another teacher who's of the same age, and they got talking about hearing aids. And the other teacher was like, I hate them, I don't wear them. And they both sat down with their hearing aids in the containers, kind of slammed them on the table, and proceeded to have an entire conversation yelling across the table at each other. And I just sat there, I was like, I think they were utterly delighted that they were not putting in those areas, and they were just going to.
They're fine.
I don't even know if they were fine. I don't think they even cared. But it was so loud, and I just sat there going, all right, well, aren't we all happy?
And here we are.
Yeah.
And one of my girlfriends just brought her mom to the audiologist. And of course, who wants to wear, we just talked about what a pain in the butt these things are. And she said to her mom, trying to normalize this a little bit.
Yeah.
You're getting dressed, you're putting shoes on, you're going to wear your hearing aids.
Yep. Brush your teeth, put your ears in. Yeah.
So just, I don't know if that's going to work or not, but just trying to normalize and say it's just part of your routine. You need them. Yeah.
Yep.
My mom has this too with her hearing aid, and I don't quite understand, but the feedback.
Oh, God.
I don't get that, but sometimes it's when she's on the phone.
Yeah, or they put their hand near it and it suddenly squeals.
It's like scary loud.
I know. So I don't know. I feel like the technology could be better, but that's like another web series. So solutions don't work, part 2. So that was just on hearing aids alone. We also just want to quickly say that FaceTiming and texting is, like we said before, it's an issue of dexterity. They get confused. Mm-hmm. So as helpful it is, it depends on where your parents are at.
Right. They could be fine.
Yeah. My dad's like 83 at this point. So his desire to learn technology is pretty limited. It's one more thing that he just doesn't want to deal with. If your parents are a little bit younger, but in their beginning stages, hey, if you can do it, that's great. If not, then that's the way it is.
Right.
Continue on with things that we've learned and are hopefully going to be more helpful. This is how are we going to interact with people that we love who have hearing loss? Because there's a lot of arguments that go on. There's a lot of sadness, a lot of defeated feelings when you cannot be included.
We can't communicate.
You can't communicate.
That's a basic.
It is a basic need and desire. And so we want to make sure that our family. You said something earlier when we were talking about this. Well, these are things to practice. You will not be perfect.
No.
You will not always do it right. You are going to have moments where you lose your cool and it gets frustrating and they are going to be resistant and that happens. So take all of these with a grain of salt, knowing that it can be helpful, but that you are going to try to practice these things without kicking yourself when you don't get it right.
Or remember to do it.
Exactly.
Like I said, I'm a fast talker.
Exactly.
And it's really hard for me to remember.
When you're busy.
Or I don't even realize I'm talking fast. You know?
So the things I'm learning with my dad, because he does have severe loss and he is extremely defensive about it and get into arguments about who's saying what.
Mm-hmm.
So some of this are standard things, and some of the things I've learned is make sure that you have their attention before you start talking.
Yeah.
They are very often very focused on something, even if it's just the news. They are intently reading the captions and listening as hard as they can. They're not just watching the news.
And so we're maybe worrying about what they just heard.
Good
point.
Ick.
I mean, I can't even watch the news anymore.
I can't either.
Yeah. So they are
in a state of anxiety.
Right.
Yeah. So you always want to, when you have to ask them something, even a simple question, you want to have their attention first before you start rattling off the question. I tend to just go up and touch my dad's arm or shoulder. I'll just give him a gentle touch and I'll be like, hey, Dad, as opposed to always having their name yelled or, Dad or hey, Dad. Touching them is also a way of getting their attention in a nice, gentle way.
Yeah.
It also reminds you to be near them so that when you have this conversation, you are facing them.
They can see your face. They can see your mouth.
Exactly.
Yeah.
And it is important because you want to make sure that they have disconnected from whatever thing that they're focused on and turn their connection. And I'm not just saying touch their arm and say, hey, Dad, and start. I'm saying touch their arm, say, hey, Dad. Wait till they actually make eye contact with you. And even then, you might even see their eyes are still a little bit someplace else for a split second. Just make sure they're with you. Just give it that beat.
Again, kind of that pace.
Exactly.
There's a transition that we need to be respectful of.
Exactly. You got to give it that time. And I'm just going to say, and I'll say this a billion times if I have to, don't yell from the other room. No. My mom, I love her to death, but my God, how many times does she yell to me from the other room? And I'm like, I'm not deaf and I don't know if you're talking to me or the cat. She's like, blah, 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 blah. I'm like, are you talking to me? Yeah, no, I was just wondering, I'm like, God, come into the room. I'm washing dishes. I can't hear you. And I don't have a hearing problem. So when she does it to my dad, oh my God, he loses it.
Yeah, it's not going to happen.
It's not going to happen. So just to make sure you're in the same room with them, much less touch their arm and all that. And then, sometimes I give a little topic sentence of what I'm going to say. This sounds like, I don't mean it to be condescending or anything. I'm just meaning helping them to be with you so that he
orientate them.
Yes, good word.
Yeah.
Is like orientate them.
Yeah.
So get them to understand, because you could be saying anything. You could be coming up to them and going, the house is on fire. Or you could be saying, do you want lunch? I mean, it could be anything.
Yes.
So let them know what we're going to be talking about.
Yeah.
So, and just make it really, conversational and lighthearted. But, one thing I'd like to say is know your audience.
Yeah.
And how they might respond to what you're asking or you're going to talk about. Because you don't have to have everything have the same weight. Like if I'm going to ask my dad what we're going to have for lunch, or if he's hungry, it's different than if I'm going to talk to him about his ileostomy bag and maybe we should consider getting a different barrier for the pouch.
Well, we just had this conversation with Jeff's parents. We had to start talking to them about their bills.
Yes.
And that's not something that you want to come to, the TV's going, they're upset about this.
Yep.
I mean, there is a time, a place, like we have to be emotionally prepared for this conversation, thought into that.
Anything that's going to cause a change to the way they're used to doing something needs to have the right time and a real good focus and a really good topic sentence.
It's emotionally charged.
Exactly. And it doesn't, and you might not seem emotionally charged to you. It might not seem like a big deal, but you have to be aware of their, know your audience, know who your dad is. What are his triggers? What is your mom thing that gets touchy? So be aware of those before you bring those topics up. And if they've just had something heightened emotional about something else, not the time. You're going to pick a time that would be right for that conversation. But if I'm going to ask my dad about lunch, I'll come over, he's watching TV, I put my hand on it, hey, Dad, and he looks at me and I was like, it's 2:30. I was wondering, are you hungry? And he's like, I think I am. I'm like, okay, great. Do you want this or that? And then we go into it. But I try to slowly introduce it, give it a topic sentence. It doesn't need as much weight as if I'm going to say, I think we need to change how you're doing your ileostomy change. Those are two different conversations, but they both merit a moment to acclimate. And this is what I was going to say, and I lost my train of thought a moment ago. It sounds annoying. What I'm saying sounds like, oh my God, what a waste of time. I have things
Just get to the
do.
point.
Right?
Yes.
In the short term, you are asking yourself to slow your pace down and open up this conversation. In the long term, you are creating an environment where you do not have to argue about everything. There isn't defensiveness, there isn't resistance, there isn't anger, there isn't resentment. So in the long run, you are helping yourself, not just them.
To be heard.
Because otherwise it becomes a thing of the I can't hear you, whether they can or can't. It becomes the battle cry. Right. So if you can be respectful and do this, it sounds annoying, but it really will help you in the long run. And you said it before, background noise. If we can turn off the TV, something like that. My dad gets really defensive about that too, which is weird. So I'm trying to have a conversation. I think it is in his way a little, but it doesn't seem like, so he's like, I don't see why we have to turn it off. I'm like, okay, well, I do. I want to have a conversation with you and it's blaring. And he's like, he doesn't even hear it. Well, I think he does. It is noise. It is just noise.
And it's something that you have to process out.
Yeah.
So that's one more thing we talk about, simplifying. And if the TV is going in the background, it does make a difference.
It does make a difference. One of the things is, and watch for yourself doing this, because I try not to get caught in this trap very often, but it happens. But I know my mom does it a ton. And of course, she deals with my dad a lot. So I'm sure they've got long history of frustrations. But my mom will just, you want something to eat? Okay, and now my dad didn't hear the first 3 words. This is very common. If you have not acclimated him, he didn't hear the first 3 words. What he heard was, eat. And he's like, I don't know. What did you say? Then just say it again, basically slower and lower.
And enunciate.
Yes. But not like that.
Right.
People tend to do the loud, robotic talk when someone says they can't hear you.
Yeah.
Now he's angry because you're talking that way. And it didn't really help him understand anything, because I can't hear when someone talks to me that way either.
Exactly.
You actually still need to keep your rhythm. If you make sure that you're using, we're singers, diaphragm, get a little bit lower, get under the words without all the attitude, but slow your pace down, still keep inflections, but not ...
Yeah.
The rhythm needs to be the same, just with a little bit more purposefulness toward your words. And that is, so if he says, I can't hear you, then I kind of slow myself down and I say it again, because that one was on me. I yelled from the kitchen.
Right. And you're going to do that.
Oh,
you're going to forget. I mean, it's just habits and exactly.
Absolutely.
Yeah.
Okay, so the other one is more in a professional. We've got a lot of stories about that. When you're in a group and they can't hear, or in a professional setting like the doctor's office or dealing with at-home nurses, they have a lot of energy. They sometimes talk really fast, or like you said, medical terms.
Yeah, they and I've done this. I mean, I try really, really hard to make a health literate conversation, but it's just part of your it's almost a different language and it just slips out, So an example would be a medical term for swelling is edema. And to me, I mean, no one knows. I mean, maybe some people know what edema is, but...
Well, you said it to me and I was like, a bruise? You're like, no, it's swelling. I was like, oh, right. That, because when I got my sprained ankle, it said bruising and edema. So I associated them together. But yeah, I don't really know.
Or one of the patients that I worked with, I just paused and I said, we're talking a lot about high blood pressure, hypertension. Tell me what you think that means. And he's like, well, it just means I'm really hyper.
Oh my God.
Oh. So, I mean, there's a lot of assumptions that professionals make. They're trying their best. They're busy. Right. They've got 15 minutes with your mom and dad. It's a tough thing. And I'll never forget this. So my mom was in the hospital with a UTI and went septic. And the doctor came in and did the discharge instructions. And I thought, okay, here we go. Let's see how this guy does. Right. And I honestly, Lisa, I was really impressed. I thought, man, did he do a nice job? Health literate terms. I mean, I was like, dude, nice job. All proud of him, And I thought, okay, she's going to get this perfect. And he left the room, and I said, boy, Mom, that was a lot of information. What are you thinking about going home? And it was so funny. Like he's talking to her. She's agreeing, nodding. Totally engaged, right? No. I said, Mom, what did you think? That was a lot of information. I have no idea what he said. She just wanted to go home. Okay. Yeah. So, there's just a lot. When you are in a medical situation, there's so many. Number one, can they hear? Number two, do they even understand what they're saying?
Yep.
How do you talk to them, the professional, without talking about them? That's demeaning.
Yeah. I think there's also, it's interesting because when you're with them by yourself, they can say, I didn't hear you. What are you saying? But in a professional setting or in a group setting, they will not do that typically. They don't want to.
They're embarrassed.
They're embarrassed, or there's a big group and they don't want to. I know my dad doesn't like to annoy people, but I've learned to see that when my dad's face gets kind of still and he plants a smile on his face, and he nods.
Yeah.
When he nods and he has, and I see no recognition in his eyes. It's sometimes not that he can't, here it's just he missed the first couple and now he's lost and now he's just tumbling down. I have no idea what I'm saying. So you can be even a translator in a professional setting when the nurse comes in and they need you to help them understand what that nurse is saying. I do think that comes with trust. It doesn't come right away.
No.
Because I think that like my dad does not, like you just said, he doesn't want to be talked about. He wants to be involved. He knows what's going on. He knows what his medications are. What questions do you have for him? Well, he might not be able to hear those questions. And with everybody with a mask on, he can't hear those questions. So we make an agreement. I said, Dad, I'll translate for you, okay? And I turn to the nurse or the doctor. I'm like, I'm going to translate. And they're like, oh, okay. And then they start talking just to me, which then makes him out of the triangle again. And I have to go, I nod and I say, yeah, well, Dad, you remember when you had that lung thing? And he's like, yeah. And so, I'll even stop the nurse. I'll even stop her and say, I'm going to translate that just a second. And that's both for my dad to know that I'm keeping him included and for them to know you just talked really fast and he didn't hear a blasted word you said. So I stop and then I translate and then he goes, okay. But in the beginning when I tried to do that, he was like scared that he was going to miss something. But now I'll just say, Dad, I'm going to tell her about that weird cough thing you had. Okay. And he's like, okay, he knows what I'm going to do. And then I can tell her. And then but it is like a sensitive.
Yeah.
It's a sensitive world because they want to be involved, but they can't hear. So you have to navigate that based on your particular person too. But be aware of the fact that they may not have caught a dang word that anyone said.
Yeah. And a lot of times, Lisa, what I'll do, because I'm working full time trying to do all this, I don't have time to go to the appointment. So I'll say, Dad, call me, or Mom, call me when you get to the doctor's appointment. And that seems to work pretty good, surprisingly.
Nice.
But I will say, Dad, is there anything you want to add? Did I miss anything?
Nice.
That's a nice way to include them too. Or, Dad, what are your next steps? We did that when he was at the VA, a litany of things. And I thought it was a really good educational opportunity for the provider too, because of course she listed 5 things. Well, he has cognitive, I said, can you please write those down? I wasn't there.
Yeah.
And I said, one of the things was stop by this office, And I said, all right, let's go through this one-on-one. So number 1, stop by this office. Dad, do you know where that is? No. Do you have a phone number? No. And the provider's like, oh.
Right.
The devil's in the details. So you think, well, no wonder why they're not doing what... So it's important, like, do you have something to add? Tell me what you heard. What's your plan? And they have to have something tangible.
Yep. Maybe it's just that maybe it's all of us want to appear polite.
Well, yeah, everybody wants to be
and I
kind and polite.
Exactly. So they don't want to ask, I don't know what you just said. Can you go through all that again?
I feel really bad for providers. They literally have 10 to 15 minutes.
Right.
Okay. So they're like, hey, do you have any questions? And their hand is on the door. Their body language is telling you they've got to go. And you feel that pressure.
I know we stalled a lot with one of the urologists, and I felt like the guy was so behind after us, but we just kept asking questions. I felt awful, but we needed to know. So I probably was a bit pushy and annoying. But in general, I don't like doing that at all. I will usually go with what you just said. Provider is pushing us out the door. I'm going.
And they haven't had time to process, haven't had time to questions.
So well, I'll ask then.
Yeah.
From a nurse's perspective.
Yeah.
What can we do as, whether we're there with our parents or not, what can we do when we know that this is an issue for our family? Right. Every time our parents come back and they don't know, or they are like, I don't know, he said a bunch of stuff. What are our options? Like, what can we do?
Well, and even if you're really listening, it all makes sense. And then you get home and then you're saying, wait, what? You've got to call them back. They want to help. And so you can call the office back and say, we just have a question. Can you please help us clarify this? And usually you're, speaking with a nurse. And if they don't know, they'll go to the provider. It takes a couple days. Okay. That's fine. And if it's urgent, they will call you back. The other thing I've done is I'll call the office and say, I know we usually have a 15-minute, but this is...
We're going to need longer because my dad doesn't hear well, and he's going to want to know everything.
And they will accommodate.
Okay.
Most offices will do that. And the other thing you can kind of do to prep your parents, if your parent is a talker, which you may or may not be, you can say, Dad, we have all these questions, but what are the top 2 things that we want to talk about today?
Right.
And if we have time, we'll get to these other things, but, just narrow it down so you're prepared and kind of organized for the appointment. And because it's kind of like when you get in the grocery store, it's like, okay, I've got this list. It's 4 things. How can I forget 4 things? Well, you get in there, you forget.
Absolutely.
So if you can kind of just organize your thoughts, write it down so you are heard.
Right.
And if you don't understand, that's okay. And if they don't understand, that's okay. But just that process of communication, listening and communicating back, that I did not get that. And
I feel like I would love to have notes after. Like, do you have, I feel like you kind of walk out of the door like empty-handed and hoping your brain remembers a bunch of stuff. And then you get home and my mom's like, did they say this or this? And I'm like, that's a good question.
Or you can ask sometimes too, you have to ask, I always ask the provider if I can tape the conversation.
Oh, and so okay, that's a hint and a half.
Yeah, and you want to be transparent, and I've never heard a provider say, no, you may not tape our conversation, but that's very helpful.
I love it.
Because I'll say, Dad, do you remember the doctor talked about that? No. Well, let's just go through the whole thing again. That processing time. What are you hearing?
Because when you're listening in there, it's stress listening. You're not listening with an open mind. You're listening with a fearful mind.
When we always talked about that, so let's say, this is an extreme example, but when they say, you have cancer, and da-da-da, and da-da-da, and want the peanuts, they don't hear.
They shut down.
After that, nothing is heard. So you have to, again, the seriousness of the conversation, all those things. Yeah.
I absolutely love the idea of recording it. Never occurred to me once before. I'm just like trying to record my brain. So yeah, especially if there's listening issues. I love that.
Okay, so we wanted to do an addendum.
Yeah, because, this is what we're learning.
Right.
So we want to just share because on this last episode, it was a lot of good stuff. I'm very happy with everything and I would not take anything back. However, the thing that we discovered after we were done recording that episode...
Lisa learned a tip.
Here's the thing. When my dad would watch TV, it was usually at about 58 or 60.
Significant volume.
And exactly. And his hearing aids didn't really help. And he broke one and I think lost the other one anyway. So that didn't help. And he was reading the closed caption also. Dad listened to MSNBC all the time. And if your parents are listening to Fox, MSNBC, CNN, any of those channels, which is non-stop chaos, it can make the house feel like chaos.
It's programmed. And it's loud, and honestly, it's bad news. I mean, it's
depressing.
Yeah.
My dad had an old TV. My brother very kindly got him a nice little smart TV from Costco, and it was on sale, so it wasn't even that much money.
TVs have gone
way down. Anyway, way down, right?
They're not that much.
And so once he got the smart TV, we're like, you know what? Maybe we could use headphones. One of the most important things, the headphones.
The holy grail of hearing loss.
Holy grail.
Here they are.
There is nothing better. We had 2 pair, one that actually went on his ears, and then one that covered his ears, because sometimes they would get irritated and he would want to switch them out. I mean, we didn't spend any big bucks. It was like $50, $60. One of the headphones actually had a microphone that comes down, kind of like a telephone operator, old fashioned. Yeah. He could talk to his brother on the cell phone.
So you could hook it to the phone. I didn't think of that.
Exactly.
So
TV and phone. And then we got him binge watching on Netflix, and he watched Cheers and MASH and Frasier, and so he stopped watching so much of the news and started laughing and enjoying himself. The house got quiet. I mean, I think the headphones made the difference for us in the house. Yeah. And he was able to actually enjoy himself as opposed to just live in the chaos world. It was just remarkable how different it was. And so we used it with a cell phone, with a tablet, and with the TV.
So he could understand more.
Yep.
You had peace in your house.
Yep.
And that's a win-win.
Yep.
So wanted to add the headphones. As a solution.
I think we have covered everything we can possibly cover about the sounds of silence.
Yes.
Thank you so much for joining us today. If you liked what you heard, be sure to hit subscribe and also share it with your friends and family if they're caring for their parents too. Thanks again for joining us. Until next time.
2 old friends,